Thank you, Madam Chairman, members of the committee. My name is Peter Arno, and I'm a health economist at the Political Economy Research Institute at UMass Amherst. An act relative to patient safety, House Bill 1958 and Senate Bill 1206, will enhance the safety and quality of patient care in Massachusetts hospitals. Generally, hospitals with low nurse staffing levels have higher rates of adverse patient and nurse outcomes, and these are intricately linked to poor quality of patient care and higher treatment costs, an issue that's been studied for more than 2 decades. Significant inverse relationships have been consistently demonstrated with hospital mortality, failure to rescue, length of stay, and a variety of clinical conditions. Studies have also demonstrated that inadequate nurse staffing levels lead to higher rates of job dissatisfaction, adverse physical and mental health outcomes, nurse burnout, and higher turnover rates. This wide range of negative outcomes for both patients and nurses has economic and financial implications for payers and providers. A recent study by Dahl examined the economic implications of staffing changes and found that each additional registered nurse generated about $70,000 in reduced medical costs and improved national productivity. This study did not include savings related to nurse burnout or turnover rates, which have also been linked to higher nurse staffing levels and improved patient outcomes. For example, one study estimated the turnover cost per registered nurse averaged $97,000. How do increased staffing levels affect a hospital's bottom line? Unlike some of the evidence-free testimony we heard earlier, let me just go through 1 or 2 studies. One study of 422 hospitals found that when registered nursing levels rose, there was an increase in operating costs to hospitals, but no decrease in profits. In another study of 799 hospitals, Needleman found there was little to no increase in hospital costs. You've heard about the legislation, and you know about the legislation enacted in California, which did increase nurse staffing levels and was associated with lower patient mortality, less nurse burnout, et cetera. But the Medicare cost reports show no decrease in patient in profits. Finally, the Affordable Care Act has introduced at least 2 measures to improve quality of hospital care that may be directly linked to nurse-patient staff ratios: value-based purchasing and readmission rates. And in the written statement we provided for you, you will see hospital by hospital rates for this in Massachusetts. Let me just say that one final study on the readmission reduction program that's run by CMS penalizes hospitals for excess readmission rates. And a recent study found that hospitals with higher nurse staffing levels had 25% lower Medicare readmission penalties. So I think in closing that raising inpatient nurse staffing levels, which has been demonstrated to improve quality of care, is a moral, a political, and an economic imperative whose time has come. Thank you.
Thank you, Peter.